All right, we're going to get started again. Hope everybody had a nice break. And now I'm excited to introduce Dr. Ece Bayram. So Dr. Bayram did her training and earned an MD and PhD at Ankara University in Turkey. And she did fellowships in research at the Lou Ruvo Center for Brain Health in Las Vegas, and also at the University of California, San Diego. So she is a clinical researcher, and she's very committed to research, education, and outreach, and has done a lot of creative things in those areas. She studies sex differences and race differences in Parkinsonian disorders and is funded by the NIH and the Lewy Body Dementia Association. She's got leadership roles in the Movement Disorder Society and other foundations, and we're excited to hear her give us some updates on research at the University of Colorado. Thank you, Dr. Bayram.
Right. Well, thanks everyone for sticking around. I'm excited to dive quickly into the research. This is going to be a pretty short talk, so I'm probably not going to give you updates on studies you're curious about, but hopefully at the end of this talk, you'll feel like, man, research is cool. I should be a part of this. This sounds pretty nice. Right. So, surprise, surprise, for any type of clinical research, you need participants, and those participants are you. So, we're doing this research for Parkinson's, including you, people with Parkinson's, or people caring for your loved ones with Parkinson's. And the problem is, it's not easy to get people into research. I know if you hear about research, you're feeling like, yeah, we support it. There should be research. We need more effective treatments. We need more knowledge about this disease. But unfortunately, we face delays in running these studies. We really struggle getting people in, and we lose a lot of knowledge from these studies because we can't get participants. And this statistic was from the Michael J. Fox Foundation. I thought it was pretty striking. 85% of the trials face delays and 30% never even get off the ground. If you think about all the help we need from research, these are really high numbers that we really need to overcome, because we know our eventual goal with research is to get rid of this disease. We're not trying to, spend time, fool around, and just have fun. We really want to get down to business and cure this disease and be rid of it. We're going to be happy if this research is off our plates and we have a resolution. But we're not there yet. And we also know while we are working to find a cure, we can't just tell people like, hey, all our focus is on the cure. I know what you're going through right now. I can't help you. We can't do that. So we're trying to find ways to support the community in the meantime too. So we're also working on better identifying this disease, better identify the people's needs, and finding out ways to support them while we fight for the cure. Thankfully, every year we see a striking increase in the research efforts. This year, we had over 136 trials in US with 107 agents being tested. These are great numbers, and these are human studies. So it's even way more of numbers we're looking at if you think about the animal studies that haven't made it to the human phase yet. And we see an increase in the publications accordingly too. So our knowledge about this disease really keeps increasing, and we've come a long way since we first diagnosed this disease. Everything changed about it, the way we diagnose, what we use in our clinics, how we treat people, even though we don't have a cure, and how we support people, and how we're looking at shaping the future effective treatments. It has changed. But let me remind you, right now, last year, we had over 12,000 publications. This year, we're probably going to have even more. I review studies, I review papers when they're out. It takes me like an hour to go over and give comments on a paper to my colleagues. And there is no way one researcher can be aware of all the updates happening if it takes me an hour to go over one paper. So there's no way, you're going to find a researcher and you're going to ask them, hey, what are all the updates? We're not going to be able to give you that answer. We're not going to know. We tend to focus on our specific topics because we're aware there's a lot. And that's the beauty of the research efforts we have right now too. We need a lot. We have a lot. We just got to keep pushing for more. And I really wanted to point this out. Just in general, in your daily lives, we have to deal with a lot of scam, unfortunately. People take advantage of the vulnerable at times. And unfortunately, this happens in research too. So if you feel like, hey, I want to be part of the research, I do want to participate in a study, you do need to make sure that you're not being taken advantage of. You got to make sure the study, the research team are trustworthy. All the human studies that we're recruiting for, they get approved by ethics committees. So you can ask for that information. You can ask like, hey, was the study approved? Can I see it? And the research teams will actually share it with you. If it's a trial in the United States, you can check it on clinicaltrials.gov. A lot of the recruiting trials register there because they want to reach bigger audiences. And also check the researchers. Are they trustworthy? Do you feel safe with them? Do you feel comfortable? Do you feel like they're not going to take advantage of you? It's really important for you to be able to trust the research team because research is a long process and you're creating a legacy when you participate in a research study. One of my first studies over 10 years ago, my grandma was a participant. She passed away, but that study still gets cited. It still gets used by other teams. So it became my grandma's legacy in my mind that a lot of people are still using her information. And she was this illiterate woman from a small village in Turkey that probably would have never met anyone outside of the small hometown, and her information is getting used by Koreans, Brazilians, Europeans. I think it's pretty cool, and I feel like that was a good legacy for her to leave behind. If you find a research study and you're being told, hey, this is, going to cure the disease, this is amazing, this is your one last chance to get in, etc., don't fall to that act. We are in research pretty anal and we never want to give false hope. We're very cautious. Even if we really believe in the study we're doing, we don't want to fool anyone. We want people to go in with the hope, but not the false hope. So be mindful of that. If something sounds too good to be true, it probably is not true. Don't fall for that trap. Never pay for participation. A lot of research studies, we can actually compensate you for your time and efforts, but we also have some studies where we don't have a lot of funding, so we may not be able to provide you with that support, but it's never asking for your money. A research study should never make you pay for anything. Don't share sensitive financial information. We never ask your social security or your bank account information. At times for gift cards, we may need some sort of information for that, but make sure you trust the research team before you share any of that data. And sure, sometimes for research studies, we struggle to get people and we're rushing because we want to make the deadlines, but don't get pressured to act immediately if you don't feel comfortable or safe about it. And, when you're not sure, you feel like it sounds all right, but you can't be sure, ask your provider, ask people from Parkinson's Foundation, ask your trusted organizations so you can participate in a decent, trustworthy trial. As I said, we are pretty anal in research, and thankfully, all our team members here are those people too. We are constantly getting trained in, and we are addicted to the ethical principles for research. Our first goal is always to not cause harm. We'll get you into a research study once we make sure that research study is safe, feasible, and good option for you. Sometimes you may feel like, oh, this study is a good fit. And as your providers here, you may be like, no, I don't want you in that study. I think we have a better option for you, etc. It's because we really are looking out for your best interest, and you can feel comfortable with the team here. And as you can see, we have a pretty big, nice team as well. Our research team is pretty big too, and they're really committed to this field and advancing the research. So just a quick overview of the research studies that we are currently recruiting for. I'm a big Star Wars fan, so I like including them in the talks. So we know exercise right now is the effective disease-modifying treatment option that we have. And we have some amazing researchers here that are committed to learning more about exercise. So Dr. Amara, that you've been hearing from today, she's enrolling for an exercise study here to understand the impact of exercise on sleep and cognition. And Dr. Christensen and Forrison are recruiting for another exercise trial here for Parkinson's as well. And on top of that, we have some intervention-based trials that are currently enrolling. One is being run by Dr. Kern here for people with already DBS system implants, and they have freezing of gaits. Dr. Forbes is recruiting for people with a LRRK2 genetic mutation form of Parkinson's disease to check the effects of an new agent, and Dr. Baumgartner is recruiting for a phototherapy trial. But of course, not everything is intervention. We gotta still learn more about what's happening in the brain with this disease. So we're looking into developing better biomarkers, better tests that can help us understand what's happening with the disease and help us address the disease at the clinic. So again, Dr. Baumgartner has a study for electroencephalogram biomarkers. Dr. Feuerstein is doing a sleep research, and Dr. Fullard has 2 studies to look into how people make decisions when it comes to getting DBS. And on top of that, we have these other studies. These are a bit pokey because we steal some of your blood. But for this first one, Dr. Amara is looking into the immune cells in people with Parkinson's disease, and Dr. Feuerstein is leading the Parkinson's Foundation study, PD-Gene. That is a big study that has made a lot of news and updates in our field to show us some new genetic risk factors and how the genetic risk factors are acting in people with Parkinson's. So they're still recruiting to get a better idea of the genetic risk factors in the Parkinson's community. And we always have studies in the pipeline that are going to be coming up soon. Stem cell therapy has started getting a lot of attention and is showing promising results recently. So Dr. Baumgartner is going to lead that arm of the study here for a stem cell surgical intervention, and Dr. Aslam is going to lead a study for skin tests to help improve the diagnosis of Parkinson's here. So if you're feeling like, okay, like some of those studies were interesting or none of them were interesting, but I kind of want to know more about what's in the pipeline, you can always sign up for the newsletter. This doesn't mean you're directly entering the research. You're still going to make the decision to select which research study you want to participate in. And even when you participate in a study, you always have the option to leave the study. If something happens, if you're no longer able to participate, if you don't want to carry on with the study, you're always able to leave the study too. So 3 ways of reaching out to our team. You can fill out the web form, email, or give us a call. And then we'll probably take some of your contact information, and a recruitment specialist from our team will contact you to give information and see what studies that you may be a good fit for. And even if you don't qualify for any of the studies, we'll provide you with follow-up information to keep you updated on the upcoming research. All right, so I'm going to go over these really quickly too. We got a couple questions when you were doing your registration. So we always say, okay, exercise is good, you should exercise. And a lot of the times people are like, okay, but what exercise and how much do I do it? And it's a loaded question. Thankfully, Parkinson's Foundation put together a nice guideline, worked with a lot of researchers and clinicians in Parkinson's, and you can find this on their website as well, but I'm just putting it here in case you wanted to take a picture. And just remember, it is personalized. Just as your medication plan is personalized, your exercise plan is also personalized, because some of us are kind of not too athletic, and some of us are marathon runners. So the type of exercise you should be doing, you would need, and based on how your disease is in terms of the stage 2, is going to differ. And I would have loved to give you like, okay, these are like the excited things in research that we're looking forward to, but there's a lot happening. We're constantly getting new types of treatments, new ways to deliver treatments, new ideas about the risk factors, what's happening in the brain. There's a lot happening, thankfully. So it is a very exciting time to be in Parkinson's research, in the Parkinson's disease field, because the disease research has changed a lot over these past 10 years, and you're going to keep seeing changes too. But I do want to remind you, despite all the hype with the skin tests, the imaging tests, and all of that, we don't use them for diagnosis on their own. You may get access to a test like that, and you may be tested and you may be told, hey, you're positive. That does not mean you have Parkinson's unless you come to the clinic with the problems we would expect to see with Parkinson's. So please keep that in mind. Don't let just a test tell you if you have something or not. And also there are times where those tests may be false positive, false negative, and we take those into account when we diagnose someone. So please don't, trust those tests on their own. Still rely on your healthcare providers for any diagnostic reasons. Right now, we don't have any treatments that can slow down the disease or fasten up the disease. So we are getting research on those things, and some things are looking exciting, but right now, nothing is FDA approved. So if someone's telling you, hey, this is FDA approved and this is going to slow things down for you, be mindful. We don't have anything right now. And, sometimes research news, a lot happening. They're hard to keep up with. Thankfully, we have Parkinson's Foundation, Michael J. Fox, that share community updates. So you can track them and you can kind of see what's happening in the field, what are the exciting things to look forward to, because they do have specialized people that writes those updates. So it's digestible and a bit easier to understand, so you don't have to get lost in all the terminology you may use. And with that, I'm going to end with a shout out to Ozzy. I'm a big metal fan, and I was devastated when he passed. And one of his last interviews I really admired, he shared that he was asked, like, aren't you suffering because you have this disease and you're not in a good state? And he was like, I'm just happy I get to still spend time with my family and still be around. And I'll take the disease any day as long as I have my family with me. So I hope, people like that continue to inspire me. And I hope you remember that, despite it all, we're still here and we're still fighting alongside. So I hope you have as much hope as us, and you'll continue supporting research. Thank you.